My name is Sarah Schaefer and I'm a member of Group 18. We were partnered with the Neighborhood House program at the Barbara C. Jones Elementary School. Understanding one's background, but also their lived experience, is important when intervention planning on an individual or community level. If we cater the intervention to the needs of the population, we will see better outcomes for our clients. In identifying the needs of the population, it is critical that we identify our own biases, as they are barriers to effective treatment. Going into the Barbara C. Jones School, I had a belief that the school would have a low socioeconomic status. All of this was based on research we did prior to our first visit. But when we got there, we realized that the school was very well off and had a number of wellness programs being implemented for the benefit of the children. The thing that surprised me the most was the fact that many children were not able to participate in our 911 role play calling activity because they didn't know their home address. I believe that this type of communication between parent and child is crucial for a healthy relationship. In population health, it is especially important to address these communication shortcomings, as the systemic issues such as this affect the entire generation of children as they grow and develop. In order to maximize the benefit of population health services for our clients, we need to make sure that the lines of communication are open between healthcare provider and client, as well as between clients and their loved ones. Through an experience at the school, I saw an instance of ineffective communication. During one day of our intervention, the after-school coordinator organized a fire drill to complement our fire safety program. When the bell went off, the children went out the door screaming and running to their safe area, despite our programming having addressed how to safely evacuate a building that is on fire. When all the kids were outside, the women started yelling at them, telling them how embarrassing they were to her and how poorly they had completed the fire drill. The kids were mortified and upset. Of course, they did not behave appropriately in this situation, but I did not like the way that she handled it. This was uncomfortable to witness, as many child care professionals agree that it is best to correct children's behavior in private instead of calling them out in front of others. However, as a student visitor, it was not my place to say anything. When I am a practicing OT, it will be my job to advocate for my clients, especially when I feel like they are being treated unfairly. One of my weaknesses is that I am non-confrontational, but I will need to learn when to intervene for the good of my clients. As a clinician, it will be very important to know my professional boundaries, when to advocate, and when to step back. This is an ongoing process, and I am still learning and practicing this skill. Being involved in a community wellness project has given me an opportunity to interact with people outside of a healthcare setting, which has helped me develop interpersonal skills that will be beneficial to me as a clinician.